Welcome to The PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in. As you well know, and as I share in my introduction to this show, physician associate has taken the place of physician assistant as the professional title of choice. But what exactly does that mean for your practice? Should you start using physician associate in everyday interactions? Why or why not? Today, we're going to unpack the physician associate title change implementation so you can understand when it's okay to start using physician associate, depending on where you live and what changes have been made to your state and national legislature. This episode is from March of 2023, using the most current information from the AAPA as the main source for title change from a professional standpoint. One of my very favorite things about being a podcaster is crossing paths with other incredible podcasters. If you love this show, especially when I share about my experience with healthcare burnout and recovery, you're going to want to check out the podcast, Burnout, What I've Learned So Far, hosted by my friend Meg Letty. Meg is a former CT surgery PA turned advocate for healthcare provider wellness. Turn in to hear how she recovered from burnout and integrated well-being into her life to create a life of dreams, not nightmares. Add Burnout, What I Have Learned So Far with Meg Letty to your podcast queue to start your journey to wellness and healing today. So where are we at to begin with? Here's where we are. The current official title of the PA profession is physician associate. The AAPA is now called the American Academy of Physician Associates. The current recommendations are to continue to use PA or physician assistant as your official title, your legal title in a professional capacity, and particularly within a clinical setting where you're working with or speaking to patients. So even though we've changed the name to physician associate, in that clinical setting, in your contract legally, we're going to keep using PA or physician assistant. Going forward, and at the time of this recording, the AAPA is using physician associate whenever possible, which right now is any time that it doesn't present a legal or regulatory conflict in the use of the new title, physician associate. So where do we go from here? It's a process to change the legal title from every aspect as a profession. This takes time and changes from many different organizations in addition to legally. As with all things, this doesn't happen in a vacuum, and there are many factors in such a process. Besides the AAPA, there are other main national PA organizations, specifically the PAEA, the NCCPA, and ARC-PA, as well as specific PA programs across the country and AAPA constituent organizations. Then there's the government, whether at a state or federal level, and their regulations, and also your employers. So that is a lot of different people and places that need to get on board before physician associate is widely accepted and all the paperwork and legalities are worked out, and physician associate can be freely used across the board, regardless of what state you're in. The AAPA is the go-to source for these updates. So if you're not sure about your state and you haven't seen an announcement, you can go to your state organization or check the AAPA title change resources. So you may be wondering, are we using both then? In a word, yes, you can expect to hear both physician assistant and physician associate in places like the AAPA website, in your practice, your organization, and in your community. And honestly, that's probably going to be happening for the next few years. I've never done this before, but I'm going to share something intimate, literally about my intimates on the podcast. After trying Vibrant Body Company's certified clean first layer bras and underwear, I threw everything else away. Life is too short to wear bras that don't fit. So schedule your virtual fit consultation with their master bra designer, Heidi. You get to Zoom, do live measurements, and find the exact right fit for you before ordering. Use the link in the show notes or the discount code Tracy15 for 15% off your Vibrant Body Company order. Make sure you try the thong and the semi-demi everywhere bra. You'll thank me later. So maybe you're wondering, why did we change the name anyway? So physician assistant was reviewed and 90% of PAs felt like physician assistant didn't accurately represent what they were doing for their actual patients. Specifically, that word assistant didn't adequately represent what we do as PAs. Changing from physician assistant to physician associate helps to dispel this myth or misunderstanding that PAs were simply there to help or assist the physician with patient care. There was also some confusion about physician assistant versus medical assistant and what that meant and what that person's role was inside of the healthcare team. We do so much more than assist the physician, as you well know. So, changing the name of our profession to physician associate stemmed from our desire to have a professional title that ensures clarity about the education level, participation, and work that PAs are doing as a part of the healthcare system. So, what about our scope of practice? Is anything going to change with that? The professional title change will not have any impact on your scope of practice or the scope of practice for PAs in your state or in the country. As with before, our scope of practice will be determined based on our education and training, licensure, experience, and credentials and competency. So, nothing changing from a scope of practice standpoint. So, why aren't we using physician associate yet? We said we've changed the name, we're physician associates yet. Why can't we start using it? So, part of this episode was because I wanted to do some research about this and really understand myself what the status was and why we're not using physician associate yet. So, per the APA, we should continue to use physician assistant as our official legal title in any professional capacity, again, particularly when working with or speaking to patients. So, when is it okay to start using physician associate as our day to day title? So, when the jurisdiction governing your specific licensure and practice has formally adopted the title of physician associate, that's your sign that it's all clear to start using physician associate in clinical and professional settings with patients. The concern here about starting to use physician associate too soon is getting too far ahead of the laws and regulations of changing the name. So, in order to avoid any regulatory challenge or discipline from people like the licensing board or the attorney general, it's best to continue to use physician assistant until the rules and regs catch up with this title change. Another reason is that your employer or hospital could view you introducing yourself as a physician associate as a violation of their policies or professional bylaws. So you want to make sure all the I's are dotted, all the T's are crossed before you start saying physician associate at work. Essentially, this is CYA to make sure you're covering your butt from a legal standpoint, that you're in compliance with your malpractice insurance coverage and with the bylaws and the regulations where you work. It's best to err on the side of caution and continue to use PA or physician assistant as you have been previously. This is something I've sort of been struggling with because as a brand, I rebranded, I relaunched. I started the show The PA is in. And is it the physician assistant is in, or is it the physician associate is in? And I guess the answer is right now it's both. Someday in the not too distant future, it will be the physician associate. I have always introduced myself to a patient as a PA. And if they ask, I certainly explain physician assistant and talk about my training and degree. But most people don't ask. So I would say I'm Tracy, the PA. And so one great thing about physician associate is it also starts with PA, and it's the same acronym. So if you introduce yourself as a PA, there's not this major need for you to change anything ongoing. All of this to say that consistency and consistently using physician associate across the board, once it's legal and in compliance to do so, and presenting this united front has having one single title as a profession is super important to our growth and our future as a profession. So when it comes to your specific state PA chapters will be in the foreground of title change in your state. If you aren't already a member of your state organization, consider joining and consider seeing if your employer will foot the bill as part of your CME or membership budget. Even if you don't join your state organization, which you should, hop on their email list so that you'll be informed with any legislative and policy updates in your specific state. If you aren't sure about the timing of updating your state organization name, reach out and ask them what the timing of that looks like. The bottom line here is that patients deserve to understand clearly how PAs participate in their healthcare and what role we play in providing their care. A more accurate title, specifically physician associate, will improve their understanding from the first introduction and hopefully result in better overall patient experiences. This title change has been a long time coming, and it wasn't something that was undertaken lightly by the AAPA. In fact, it was more than 2 years in the making before it ever reached the point that we are at now. If you like processes or you're intrigued and want to take a peek at the timeline, I will link the AAPA timeline for this professional title change in the show notes. Check it out. It is interesting to look at. It's great to see the amount of diligence and determination that went into getting to this point as an organization. That being said, we are now really in the heart of this turbulence that is the title change. And with all things, this thing takes time, and patience is a virtue. Be smart about how you're using the title, specifically in clinical practice, and also consider getting involved in your state or national organizations so that you are more aware and are moving this change forward so that we have one single title unifying us as practicing physician associates. Thanks for tuning in to another episode of The PA is In. I will see you next time. Congratulations, you've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.